Hey everyone, I'm John Lind, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Aaron Patzer. He's CEO of Vital. Welcome, Aaron.
Thanks for having me, John.
Yeah, so excited to learn about your company, Vital. Tell us a little bit about yourself and Vital.
So I am an engineer by training, but this is my 7th startup. I'm still best known for being the founder of Mint.com, the largest personal finance tool in the US and Canada, like 25 million users. Started Vital, which is healthcare, very different industry, 6 years ago with my brother-in-law, Dr. Justin Schrager.
Okay. Interesting. Well, I'm one of the 25 million. So, in fact, I think I had a few accounts, but
good double count.
Kids and
Yeah.
But that's really interesting. Why did you decide to move from Mint and the financial services and into healthcare?
They're both like quite regulated industries.
Yeah,
all the VCs said nobody's ever going to let you put all the bank usernames and passwords into Mint, and 25 million people did, 100 million usernames and passwords. And rightfully so. We've never had any security breach at Mint, at least that I'm aware of since I left. Vital, also a regulated industry in healthcare, but it was kind of a natural fit, this one, because all of my family is in healthcare. My brother-in-law is my co-founder. He's an emergency room doctor. My sister's like this sort of famous epidemiologist.
Okay.
My dad worked in pharma. Like, everybody in my family is in healthcare. And you take for granted that when you have family in healthcare, you can just ask questions like, What does this mean? My medical note said, epithelial squamous cells. And you're just like, is that good or bad? And the doctor's like, it's fine. That's just what you call this kind of cell. And most people don't have that. And so in some sense, the purpose of Vital is to bring doctor and nurse knowledge to you exactly when you need it. The first place that we have started is the emergency room. So we have over 1 million patients a year being guided by our software. It's all AI powered. How long are you going to wait till you see a nurse? How long are you going to wait till you see a doctor? What is a CT scan? And, we see that you have a couple abnormal results. Here's a couple of videos to watch that might help explain why that is, or why we need to do the next test that we're doing. It's super, super patient friendly. I'm really big into design. You might have gotten that with Mint, and making kind of complex and highly regulatory industries fun.
That's really interesting. First, that you now fit in with your family, so you work in healthcare, they'll let you stay.
That's right.
But more importantly, like, you're taking something that's really complex. I just went to the EED myself.
Yeah.
and had all of those questions, right? We were Googling, we were doing all sorts of stuff.
Yeah.
Is this something that the health system purchases and then they implement to make the user experience better, or what's your approach there?
It is, yeah. So we're in over 100 hospitals now. We have huge health systems as customers: Dignity, Common Spirit, UPMC, Emory, Alina, if you live in the Minnesota area, LifePoint, Louisiana medical centers, just a lot of healthcare systems. And they purchase the software. It's available to every patient who walks into the emergency room or who stays overnight in these hospitals. Depends on how big the hospital is and volume and all of that, but it'll cost you somewhere between 60 and 100 grand per hospital to implement this. It reduces left without being seen and increases your HCAP scores, and it pays for itself, 5 to 10 times over, because people follow their follow-up instructions and stay with your health system, which is super important. But most important, it's got super high patient engagement. So 60% of people in the emergency room or an inpatient use this software. There's a major EHR that I won't name, and their software has about 8 to 12% use from what I can tell talking to our customers. We literally have 5 times the utilization because we make it so easy for patients. We have family sharing built in, where you can see the status of what's going on with a family member who might be in emergency. Super useful for parents. Like, if a kid is with one parent, the other parent wants to know exactly what's going on. It gives you real-time updates. So that's our bread and butter business. But today we're coming to you from AI4 conference. We announced vital.io/translate. It will take any medical note, which is full of jargon and abbreviations you can't understand and squamous epithelial cells. And it'll tell you what that actually means in plain English that anybody can understand. It's free to use. It's available worldwide. It is HIPAA compliant. I'm big on security as the Mint guy. And so it's safe to use. You can put all the PHI in there that you want. It's not going anywhere. It's all encrypted. And whether it's for you or a family member that you take care of, an elderly parent who can't always relay their information from a doctor's visit, super valuable to get that translated into something you can understand. And then also really valuable for clinicians as well. 2/3 of medical notes go unexplained. They're not going to tell you what this note meant, or they don't have time to discharge you properly. And this provides you a way to understand all of that so that you don't just throw your discharge report away, so that you do the follow-ups that you're supposed to, and you'll be healthier for it.
Yeah, I would say 90% of them don't even get looked at because they know that it's going to be jargon that they don't understand or can't comprehend.
The hospital is the only place where they give you like a printed packet of information. It's like 15 pages long. Half of it is like, don't smoke. Well, I don't. COVID, all right, you're 2 years late. And then a bunch of like boilerplate stuff. And then somewhere on page 5 is the really important stuff, but you can't find it because it was off a dot matrix printer. So vital.io/translate, you can take a picture of your medical note, you can upload a PDF, you can cut and paste the text, lots of different ways to get it in there, and it'll just translate it. And if there's still any medical terms that you don't understand, you just hover over them and it'll define them. You don't have to Google them. It's safe. It's been approved by a panel of doctors as 99.4% safe. Wow. The last 0.6% is usually, we try to summarize, a 10-page report into a paragraph. Sometimes it's too complicated to get down into that paragraph, but it is way more accurate than human doctors when we ask them to perform the same task. They don't summarize nearly as well as this AI.
Interesting.
Because they don't have enough time.
Sure. Well, and they're not used to that. That's not the skill that they've built. They've built a skill to diagnose it, and half of the time they don't even know that they're doing it automatically in their head.
That's what doctors should be doing. AI should be looking through 100 pages of your medical records so it doesn't miss the important bit and finds that to give the doctor a summary so that when they have their 7-minute or 15-minute visit with you, they're well prepared.
Now, is this a direct to consumer? It sounds like anyone can go there.
It is direct to consumer, yeah.
Are you going to do an API on top of that, or what's the plan? Or is it to enable patients? You're going to start competing with ZocDoc, and I don't know, like what's the business driver and goal here? Yeah,
well, so we wanted to put this out because it's good for the world to understand your medical reports. We hope that health systems will use this themselves and be like, these guys are good at AI. We should buy their software. So I'm trying to sell more of the enterprise software, to be candid. And the long term is that this is patient facing. We will be able to put this capability inside the EHR. So if you want to say, summarize this note, summarize this patient who has gobs of information, this is the technology that'll do it. It's non-trivial to do because you can't use ChatGPT for HIPAA compliant stuff.
Let alone hallucinations, etc.
Let alone hallucinations. So you need all the guidelines that we've built in, all the double checking, all the quality reports that we've put into this. So it's been a journey for sure to get to this point of quality, but it works well. Interesting. So is that the main goal? You started in the ED obviously with the hospitals and health systems. Are you going to expand this to other areas of the hospital? Are you going to go to ambulatory, pharma? It seems like everyone could use this capability. So we have a few products. So we have our ER advisor that guides patients through the emergency room experience. What are your wait times? We predict those with AI and what to do next. We have Care Advisor, which is inpatient setting, patients who stay overnight in the hospital. And it's like virtual call buttons. I need a charger for my phone. I want a volunteer visit or a visit from the priest. Explains all of your lab results. It also explains, like, you got an x-ray, you don't understand what a lateral malleolus is. It's part of your foot, but I didn't know that. I had to look it up. And it's like, you broke your foot. And it's like, oh, okay, that's good. So this is built and baked into our core products already. Next we'll probably go into ambulatory surgery centers and maybe the outpatient urgent care setting to be just like a complete patient experience, regardless of where you are in the health system. Because all of you CIOs out there, I hear you. You don't want point solutions. We're not a point solution. We cover a broad swath of the entirety of your patient experience, follow-ups, communications with patients. So that's where the future holds.
Awesome. Where can people go to learn more about Vital?
You can go to vital.io. Super simple.
Easy enough. Awesome. Well, I appreciate you taking time to talk with us and share about your product. It seems like, I was surprised. I knew you were doing the generative AI kind of for patients and kind of the reverse of a lot of what people are doing, which is making it simpler for patients. Some of them make it more complex, which is interesting.
Yeah.
But, because you want it more scientific or more detailed.
Yeah.
So it's interesting you're going the other way. But the fact that you're doing the full spectrum, that's really interesting. And kind of from intake all the way through, did you do the discharge instructions?
We've been working on AI algorithms for healthcare for 6 years. We have 12 models. We have, half a dozen peer-reviewed papers. We have IRB studies. Like, we take this seriously. I'm an engineer by training. I don't know if people can tell just by talking to me. So I have 10 patents in algorithms. So this is like an area that I'm just like passionate about.
Awesome.
Yeah.
I appreciate you coming on and sharing more of that.
Yeah.
And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks, Aaron.
Thanks, John.